They're all sitting on the cart. When you open this up, can you see? Lots of junk. This one, not so much. So inside your kits, you need an ABD or an abdominal pad, the blue side out, 3 gauze. That's all you're gonna have in there. Everything else will be out. Theirs, they start from the beginning and take everything out sterilely. You do not need tweezers or scissors. There's usually curl. You don't need Curlex. You don't need any of this stuff. That's why I grabbed an extra one. So this one, put the pieces out. So our pieces should be the kit with those inside of there, a biohazard bag, because we're usually using blood, a measure, a cotton tip applicator, which I will have inside the actual paper outside, sterile gloves, clean gloves, okay? Wound water. Number 1, it tells you to look at the medical record for the location and size of the wound. Again, we want to be prepared for what are we doing? Where are we doing it? How many supplies may we need based on size? We want to review the order for the dressing change. We want to gather all of our supplies. We are going to not introduce ourselves to patient identifiers, ask our patient if they have any allergies, especially to cleaning products. Again, chlorhexidine, whatever, betadine, if we needed to use that, we would need to know. We are going to tell them that we're here today to do their wound care. We're going to ask them to not touch any of the supplies once we get started. We want this to all be sterile. Then it tells you under number 11, assess their level of comfort. So you could say, it's gonna be Judy. So Judy, what is your pain? Can you tell me your pain on a scale from 0 to 10? I'm gonna be doing some wound care. Would you like something for it? Or if I say my pain is a 10, I would give them something for pain relief and come back in 30 to 60 minutes to make sure it's working so I could do the wound care. So always 30 to 60 minutes. Then we are going to perform hand hygiene and we're gonna put on our gloves, and it tells you to position the patient comfortably. Obviously, it's gonna just be sitting there, but you know, if it was on their bottom, we could roll it to the side or whatever we needed to do. Have your garbage bag within reach, and we have our clean gloves on. So you can just some of these are all folded together. You don't have to take them. You can just pretend. We'll just have our bag there. What we're gonna do, we're gonna take off the sides of the wound one at a time, take off the tape, and we're gonna look at each layer as we're taking this off, which is what it tells you for number 17 and 18. So we're taking off the top. So I'm looking at this first pad and I don't see anything on there. So that's good. I mean, that's good. There's no drainage. Then I'm gonna take out the first gauze. I'm starting to see some drainage. I'm taking out the next gauze and I have more drainage. We're just going layer by layer because there could be other stuff in here like pus. So some of you may have pus next week. We're just looking at each one as we're taking it out. It's starting to get a little bit more, a little darker. Now I've come to the bottom. So then it tells you, assess wound using medical terminology. There are 5 things you have to talk about. The first one is the color of the wound bed. What does it look like inside of here? What colors do you see? It's just asking color. Is this red? Is it yellow? Is it black? Is it tan? Is it green? What colors do we see? Currently it's red. I just see red. I don't see any other colors in there. So we're looking on the inside. The next one is edema. Does this feel swollen? Obviously it's fake. So you could say, as you're feeling around, yes, I can feel that there's edema, or no, there's no edema. There's no swelling. The next one tells you, is there exudate on the dressing? Did you see pus? If you have pus, yes. If you don't have pus, no, I don't have any exudate. Drainage on the dressing. It gives you 3 terms. Serous, serosanguinous, and sanguinous. Serous, clear, yellowish type fluid, like when you skin your knee, it's kinda, there's some fluid coming out of it. That's serous fluid. It's clear yellow drainage. Serosanguinous would be the top one where it's very small, like a light pink. It's kind of a mixture of blood between the clear fluid and blood. Sanguinous, there's blood. So I would say on my dressings, I have a mixture of serous and sanguinous blood. And that's all I have to tell you. And then it asks you the amount: scant, moderate, large. Oh, I forgot small. Scant, small, moderate, large. So if you look at these slides, so scant, there's like the one dot. Small, maybe one or two full gauzes. Moderate, you know, a couple more. This, I would say this is between a moderate and a large amount. I mean, almost every gauze that's underneath there has some drainage on it. Some of them I make, like you can actually see the drainage on the outside of the actual pad. Again, a large amount. So now what we're gonna do is we're gonna measure the wound with a cotton tip applicator. So this would be clean inside the package. We'd open it up, cotton tip applicator. What we're gonna do is we're gonna measure the wound. We're gonna measure the length from the top to the bottom. I do it this way, you don't have to, but I take the top of the cotton tip applicator and put it at the very top of the opening. And I go all the way to the bottom and I kind of pinch where I can kind of see the bottom is. I'm gonna take this and now we're gonna use our little measurer. This measurer has a circle in it, which looks like a bullseye. We're not gonna use that. It has an inches side and a centimeter side. Because this is healthcare, we're gonna use centimeters only, don't use the inch side. And I'm just gonna line it up. So from the top, I'm gonna put the top at 0, and I'm gonna measure this wound. All of your wounds are not gonna be an even. So if it's close to 14, say like 13.9, none of them are on. If you physically took this and put this on here, we're not doing this because this is sterile. So other people, you'll see like in real life, will just take this and use the measure on the wound, but we're trying to pretend that this is sterile, so we're gonna do it. So we have 13.9, then you're gonna go for the width, whatever you think is the largest part. Not all of your wounds are gonna look like this one. There's a butt inside of there that has multiple different wounds with multiple different sizes. Some of them are circular, some of them are kind of jagged, but we're gonna go from the part that we think is the largest across. I'm gonna measure again. My width is now going to be 2.7, and now I'm gonna do depth. I'm gonna go in the deepest part, and some people like to hover. I think that that's kind of weird. You could also just go on an angle and just go to where the skin meets the middle. And I have 3.3. So you've measured. Now what we're gonna do is, all of this is garbage. I'm gonna take off my clean gloves and I'm gonna start preparing my sterile area. I just need to grab this or else the water's gonna go all over the place. So we're gonna prepare our sterile field. So we're going to open our package sterilely. Whenever we open things sterilely, we want to see, one, is this expired? Just like the medications, because we don't want to use anything that's expired. I just want to keep this. We want to make sure it's not expired. We want to make sure that the integrity of the package obviously will be open, because we're not using it the way that the other ones were packaged. But we want to make sure that it's not opened. And what we're gonna do is we're gonna peel it away from ourselves when we're opening it. And if you want to, you can just put this top part underneath and just set it down. The other one we're gonna look at is, again, our fluid. What is the expiration date? When we pour fluids, we want to not pour them like it's a waterfall. We also don't want to pour them so that we're touching the container. About a height of 1 to 2 inches above. We're gonna open it up, and before we put anything else on, we're going to, this has the label facing us. We can just pour. If you can see, I barely poured anything at all. We keep using water. It's just, by whoever's number 4 is gonna have like a puddle if we use too much water. We can use just a little bit. I may need a little bit more just to be able to, oh shoot, I forgot a syringe. To do this. Next, we're gonna put on our sterile gloves. Obviously, working room, I'm just gonna move this over a little. I'll give you a separate table so you can put your gloves on next to it. The way we're gonna open these. Sometimes they're folded like this, sometimes they're folded over even more, but however they are, can you see that it says cuffed end? That means that the cuff is going towards you, like you're gonna, like in a doctor show, you're gonna slip your gloves on. So that's where the opening is. When we do this, we're gonna open it again. So now it's gonna be a large rectangle. Again, cuff end towards you. Now we're gonna open it like a book. So we're gonna open the book. It tells you specifically left, right. So if you have it upside down, you could flip it so you have your left hand and your right hand. When we get to here, we're going to grab on to the little edge. We kind of put our fingers out so we can grab onto this. This is considered not sterile. And I'll show you in a second what that means. So we're gonna open this up. Now we have our sterile gloves. If you can kind of see, there's like this little border around the gloves. That is considered not sterile. The thing inside the square is considered sterile. So we've opened up our gloves. I personally put my right one on first. If that's my dominant hand, if you want to put on your non-dominant, I don't care however you get them on. What we're gonna do is we're gonna pinch the bottom of the sterile glove to lift it up. I'm gonna take both my hands and open it up so I can actually have a hole to stick my hand in. I'm gonna place my hand inside. I'm gonna kind of wiggle my hand so I can get into the fingers. I'm gonna pull it down without touching. See how it's still rolled? I'm not gonna pinch up here and touch. I'm gonna keep touching underneath on the rolled part. Now my right one is on. This is where it gets tricky for people, is to put on the other glove. So your gloved hand is going to pick up underneath the cuff, and the other one is going to touch the outside where it's still rolled. So I'm gonna put it underneath, I'm gonna stick my hand inside, and now your gloved hand is gonna be the one that's going to roll this down. This one's completely unrolled. If you wanna come back to this one, as long as you're pinching the outside of the glove, adjust them, interlock your fingers or pull them down, and now you have both gloves on. We don't want anything to be below our waist. We wanna keep our hands above that. We're working with the sterile stuff. If you want to, you can pinch in the middle to move your paper wherever, off to the side. So now we can work with stuff. So now that we're in here, I should have dropped a syringe. I forgot to grab one. I'll do it for your other video. We should have dropped a syringe in here because we need to irrigate the wound. We'll irrigate it first. So I would take this syringe, I'm gonna draw up 2-3 cc's of water, and we're going to irrigate it by just pushing the water out into the wound. If you want, you could take one dry gauze. You can put both your hands in here because everything is sterile. And this one, just be careful. And we would just kind of dab. Okay? Drop it somewhere else because now that is considered dirty. It's touched the patient's skin. We don't want to put it back inside our kit. Now we're going to take another gauze or two. I accidentally grabbed two. We're going to take it, get our water, bring it out. You don't need tons of water. I'm just going to pretend that's still in there. I need 2 gauze. We're going to unroll them. This is where they have the tweezers and the other cotton tip applicator. We could use the cotton tip applicator to put it in there. I'm just telling you, it's just kind of place it. We're not like packing it. So they're in there, they're not hanging around the edge of the wound. Now we're gonna take our 2 gauze, put one on top, one on the bottom. Pad, blue side out, on top. Then we would change out our gloves. You don't have to change them out. Now I'm gonna come to my tape. No, because it fell. We're gonna tape it, all 4 edges. Oh my God, if I can rig it off. Another piece of tape, date, time, initial, because we'd want to know when they changed the dressing. Put our patient in a comfortable position, whatever we need to do, but I have to watch you guys take these off sterilely. So it's at the end. So I just have to make sure that you pinch the outside of the glove, not on the cuff, but the outside of the glove, and pull it off into your other hand. We're gonna take our other finger and put it under the bottom and roll all of our gloves together. That's it.